Good afternoon, ladies and gentlemen. Welcome to St. Paul Fire Station number 1. I'm Fire Chief Tim Butler, and on behalf of the 475 men and women of the St. Paul Fire Department, we want to thank you for being here today and share some great news for our medical patients. We're going to hear about some great technology and some great work being done by some local organizations to help bring superior management to cardiac arrests in Minnesota. We're here today at Station 1 for an event which is really part news conference about the Lucas device and part award ceremony for the people who helped make this possible. We have 4 main purposes today. I want to introduce you to the Lucas device. It's an automatic CPR machine. We're going to tell you how the machine works. We're going to demonstrate it for you here. It has some significant benefit in helping heart attack victims around the metro area. Today we get to have that device join the St. Paul Fire Department. We're also going to introduce you to some local leaders and organizations who made this possible. The investment to buy 13 of these, one for each of our St. Paul Fire ambulances, was about a $200,000 investment. We could not have done that without some great partners in the community. I'll be presenting the Lucas partners with the Fire Chief's Special Commendation for their extraordinary generosity and superior leadership in bringing Lucas to our paramedic crews. And then I want to have everyone have the opportunity to talk to our award recipients and also ask questions about Lucas and show you how the device works. Joining us today are key leaders from the United Hospital Foundation, the Minnesota Resuscitation Consortium, the St. Paul Fire Foundation, Allina Health Emergency Medical Services, Regents Hospital Emergency Medicine Department, the St. Paul Mayor's Office, Physio Control Corporation, and the firefighters and chief officers of the St. Paul Fire Department. Sudden cardiac arrest or heart attacks occur in over 300,000 patients annually in the United States and over 200 times here in St. Paul. Patients typically have less than a 5% survival rate if they have a heart attack outside of the hospital. The success rate has been largely the same for about the last 50 years. We've made some new technology and some new procedure improvements in the last couple of years and increased that rate to over 20% in most cases when there is consistent, effective CPR being done. The key is consistent, effective CPR, which is not very possible most of the time in the back of a moving ambulance when you're going down narrow stairways and hallways. In fact, performing CPR under these conditions is largely ineffective and actually downright dangerous for our paramedic crews. We've been unsuccessful in getting funding for the Lucas devices up till now. Our department budgets have been cut pretty dramatically. We have not been able to get federal grants for this, so these partners that came forward and said, we'll help, did greatly help us today. I'd like to introduce Dr. Charles Lick. He's from Allina Health EMS. He's the medical director there. And Dr. R.J. Frasconi, the medical director for Regents Hospital EMS. And they're going to talk to us about the state of cardiac arrest management in Minnesota and the value of the Lucas device. Dr. Frasconi, Dr. Lick.
Regents Hospital is celebrating its 40th year of having the honor and privilege of being the medical directors for the St. Paul Fire Department. What the chief failed to mention is that St. Paul has either the highest or one of the highest, actually, over the last couple of years, has been the highest out-of-hospital cardiac arrest survival rate in the United States. These are neurologically intact survivors. St. Paul was the first service in the United States to perform active compression, decompression CPR. That's what the Lucas is based on, and it's sort of paradoxical that St. Paul is going to be one of the last services in the Twin Cities to actually have Lucas, and that's because we've been doing the research to get it done. We're Site 1 out of 7 sites for 4 years, published that research in the British Journal The Lancet in January of 2011. The citizens of St. Paul benefited from that research, and now they're going to permanently benefit from the placement of Lucas here. So again, honor and privilege to deal with this service that not only thinks about itself, but thinks about its citizens and the citizens of the world. Thank you very much.
We've had the Lucas device since November 2007, and glad to welcome St. Paul Fire and its citizens with the use of this device. Clearly does better, more consistent CPR, and I think there's going to be people's lives saved in St. Paul with the use of this device. So glad to be part of this, and glad to be here too. Thank you very much.
These devices, as I said, are expensive. The department wasn't able to purchase them on their own, and some very generous donors stepped forward to help, especially and most notably the United Hospital Foundation. The United Hospital Foundation was established in 1984, but their roots stretch back to 1853 when parishioners of Christ Church first started collecting donations to build an orphan's home and a hospital. That became the third hospital in the state of Minnesota, which ultimately became United Hospital. The foundation specializes in providing technology and programming support to the hospital and to build stronger ties between the hospital and the community. I'd like to recognize Mr. Duke Adamski. He is the president of the United Hospital Foundation. And Duke, if I can have you come up here and let you talk about the foundation, that'd be wonderful.
Thank you very much. United Hospital Foundation was happy to participate in this program. When I've been at the United Hospital Foundation as president for 30 years, and we've been building things like a state-of-the-art heart center, state-of-the-art neurological care center, state-of-the-art emergency room just recently. And you don't stop and think about the work that you do in the community. Yet I look back and I look right across the street here, and the United Hospital Foundation built the United Family Health Center, a $15 million clinic to help the underinsured and uninsured people of St. Paul. You look at the airport, the funding of, I believe it was over $100,000 for the AEDs that were at the airport and used at the throughout the Minneapolis airport. So when we were approached to participate in this program, we sat back and said, what is our mission? And our mission is to support the mission of United Hospital. And United Hospital's mission is changing. It's changing from one of taking care of patients in the hospital only and meeting them and caring for them when they're in critical need, to moving out into the community and help people live a healthier life. If we can save but one life with this device, the 50% funding that the United Hospital Foundation provided is so worth it. More importantly, though, is to give the people that work day-to-day on it, the EMS staff, the right tools to do their work. I think that the AEDs should be able to start and equip them with the tools they need to do their job. Again, we're thankful for participating in this program, and thank you for having me here today.
Another critical contributor to the Lucas Partnership was the Minnesota Resuscitation Consortium. This consortium, based in the University of Minnesota Cardiology Division, is dedicated to developing and expanding sudden cardiac arrest survival rates across Minnesota and the United States. I'd like to introduce Ms. Kim Harkins from the Minnesota Resuscitation Consortium. Kim.
Thank you for having me. The Minnesota Resuscitation Consortium, which, as mentioned, is based at the University of Minnesota, is part of the Medtronic Foundation Heart Rescue Project, whose goal is to improve sudden cardiac arrest outcomes nationwide. They've done this by having partners across the nation, and Minnesota is one of 6 states that received a grant to improve outcomes throughout the state of Minnesota. And the way we're doing that is by working with groups, hospitals, bystander efforts, as well as EMS organizations such as St. Paul Fire, to make sure that these new innovative techniques, these new ways of training, these efforts toward better outcomes can be brought right into the community where they impact patients. The Minnesota Resuscitation Consortium is also helping to collect data. By collecting data, we can actually see what we're doing right and what we could be doing better. And so the data that's being collected on sudden cardiac arrest is what's really going to help revolutionize the next steps in how we can improve outcomes. So the things that are happening here in St. Paul and many other communities across Minnesota are really changing the face for the nation on how sudden cardiac arrest will be approached in the future. And we appreciate being a part of this initiative and helping to provide Lucases here in St. Paul.
Another Lucas partner that made this project successful was the St. Paul Fire Foundation. Founded in 2010 with the dual purpose of promoting the health, wellness, and safety of firefighters and citizens, the foundation jumped at the opportunity to make CPR safer for our paramedic crews and more effective for our cardiac arrest patients. The foundation donated $25,000 to the Lucas Project, and joining me now are the foundation's Executive Director, Mary Kazi, and President of the foundation, Fire Captain Brian Kroger.
Although we are a fairly new foundation, 2.5 years old, I don't think we're wet behind the ears, and I think we've been doing very well in that short time. As the chief mentioned, we're trying to help the firefighters and the community they served, and with our 5 broad initiatives so far, we have put 10 AEDs in the St. Paul elementary schools and 10 AEDs in the parks and rec centers. And also to be a part of this Lucas device has been an honor, and we're very proud to be a partner with all of you on this. Brian Kroger with me is our president of the executive board. He's a captain and a paramedic on the fire department, so Brian will be one who will be taking part and be very thankful for the Lucas device. So again, we're honored to be a part of this, and as Duke said, if we can save one life, it's well worth the investment. So thanks again for letting us be a part of this Lucas device.
As Mary says, the Fire Foundation is it's pretty new, a couple years old. We've done a lot in those couple of years. It's started by firefighters and retired firefighters from St. Paul to work on some issues that we saw out there. As the chief mentioned, we sort of identified our issues as things that would promote the health, safety, wellness of firefighters and the community that we serve, and I think this is an example of something that we can participate in with everybody else here and sort of advance those goals. So I'm looking forward to seeing it on my rig. I've done the training. It's pretty amazing what we can do with this thing. And docs can tell you more about it than I can, but I think it's going to save a lot of lives, and it's going to make a difference in us continuing to offer the kind of top-notch service we already do and state-of-the-art stuff. So thank you.
In addition to the financial partners who made Lucas possible, I want to introduce you to some key EMS leaders who work behind the scenes to identify and encourage the partnership, and who were instrumental in helping prepare research and briefings necessary to make the fiscal donations possible. I've already introduced you to Dr. Charles Lick, Medical Director of Allina Health EMS. I'd like to introduce you to Mr. Brian LaCroix, President of Allina Health EMS. You've met Dr. Frasconi from Regions EMS, and I'd like to introduce our Deputy Fire Chief of EMS, Matt Simpson. Would you folks come up? Brian, why don't you lead off and talk about Allina's great work?
I lead the team at Allina Health EMS. In our organization, we have about 500 providers that serve about 1 million Minnesotans with primary 911 service in the state, across the state in various communities. But we're kindred spirits with our colleagues here at St. Paul Fire in terms of a keen interest and dedication to serving our communities by providing excellent care. You see, it's been mentioned that Minnesota has one of the best outcomes in cardiac arrest in the nation, and that is, for a long time, those of us who've been around for a while used to always concede that honor to Seattle. Well, Seattle ain't got nothing on us anymore. We are doing this as well, if not better, than anybody in the country. And it's because of a few things. It's because of visionary leaders like Dr. Frasconi, Dr. Lick, leadership of your department here in St. Paul, of Chief Butler, Chief Simpson, and many others. It's really about the dedication of the men and women, many of whom are here in this room, who respond to the call every day to be the best part of somebody's worst day. And that is truly an honor that we are pleased to be a part of. We are also, in my opinion, the best because we have the culture of sharing. You see, ambulance services don't compete. We have different primary service areas that we may respond to. But we have embraced, and I think it's embodied by your leadership here at St. Paul, a culture recently of helping one another like never before. We share best practice, we share information, we share operational excellence, and we share our failures so that we can learn from them. We're very pleased to be part of that movement here in this, really this country, here in Minnesota, and be a small part to contribute to what's going on here at St. Paul Fire. So thank you very much.
Thank you, Brian. I might add that interagency cooperation hasn't always been there in the past, and I'm really glad to see that it's coming out. And that's what made this project to me so enlightening. Not only do we have great fiscal partners, but great people that work behind the scenes. Somebody lined up these interviews, and it wasn't me. Bigger minds than me were at play, so appreciate everybody's work. I'd like to read some commendations. The fire chief's special commendations has only been issued one time in the department's history. We just developed the award for people who go above and beyond the call of duty, if you will, to bring a lasting and sustained benefit to the people of St. Paul and public safety. This is the second time we've made the award, and I'd like to recognize a number of people. I'm going to ask my Fire Marshal, Steve Zacher, to help me pass out these awards to these people and some other members of the staff that weren't here, and also we'll be reading a citation that goes with the award. So for Regions Hospital, Dr. R.J. Frasconi, Medical Director, and Dr. Aaron Burnett, Assistant Medical Director for Regions EMS. Let me just read one of these and then I'll read the letter after a while. Fire Chief Special Commendation awarded to Dr. R.J. Frasconi, Medical Director, Regions Hospital EMS. On behalf of the City of St. Paul, we thank you for your outstanding generosity and leadership in supplying Lucas automatic CPR devices to all 13 St. Paul Fire paramedic ambulances. You championed the cause to close a deadly technology gap for the fire department, which will help us provide superior care to patients in cardiac arrest. Your extraordinary work to bring Lucas to our medical patients will leave a lasting legacy of improved cardiac arrest management in the City of St. Paul and the surrounding metropolitan area. Thank you for helping to make St. Paul the most livable city in America. So, Doc, thank you. From the St. Paul Fire Foundation, Mary Kazi, Executive Director, Brian Kroger, President, Ben Shank, Vice President, Steve Shapira, Secretary. 4 awards for the St. Paul Fire Foundation. Thank you, Mary and Brian, and the members of your staff. I appreciate it. I should note that as we introduce Brian and Ben and Steve, always a tricky subject. They're part of the foundation, so they're separate from the fire department, but as you can see, they're not separate at all. Brian's a paramedic fire captain. Steve Shapira, the secretary, is a paramedic fire captain, and Ben Shank is a paramedic firefighter. He's the vice president. So thanks again. United Hospital Foundation, Mr. Duke Adamski, he's the president of the United Hospital Foundation. Jack Ritt, chairman of the United Hospital Foundation Executive Board, and David Beard, the director of development for the foundation. Duke, thank you. For Allina Health EMS, Dr. Charles Lick, medical director, and Brian LaCroix, vice president of Allina Health and president of Allina Health EMS. And finally, our EMS chief, Matt Simpson, for the St. Paul Fire Department. Matt, thank you. I'm going to just read one of the letters, and then we'll open it up to questions and a demonstration of the Lucas device. This one is addressed to the United Hospital Foundation. The Fire Chief Special Commendation for Mr. David Bird. St. Paul Fire Department places its highest value on saving innocent life and property, and we hold in great esteem the public and private partners who share that commitment to the public safety. When the St. Paul Fire Department faced a deadly technology gap in the management of cardiac arrest patients, the United Hospital Foundation provided significant project leadership and financial contributions to equip the department with Lucas automatic CPR devices. These actions are worthy of special recognition. The Lucas device provides automatic external chest compressions for cardiac arrest patients. For the more than 200 cardiac arrest patients treated by St. Paul Fire Department crews annually, the Lucas provides superior quality compressions and frees paramedic crews to do other life-saving interventions. When combined with other pre-hospital interventions, Lucas can double successful resuscitation rates. St. Paul Fire was the only major advanced life support provider in the metro area that did not yet have these life-saving Lucas devices, and without the financial help of the Lucas Partnership, the department would have lagged far behind the metro area's standard of care. The United Hospital Foundation generously donated $98,000 to purchase 13 Lucas devices, one for every St. Paul Fire Department paramedic ambulance. Lucas will now respond to the more than 35,000 emergency responses annually with St. Paul Fire crews. These devices will close a significant cardiac resuscitation gap in the metro area and in the city, and will be directly responsible for saving lives, improving patient outcomes, shortening recovery times, and reducing paramedic crew injuries. David, the exceptional generosity, teamwork, and leadership you provided to bring Lucas to the St. Paul Fire Department will have a significant and enduring impact on the life of St. Paul residents and the safety of St. Paul Fire ambulance crews. Your leadership on this project and on the United Hospital Foundation is a shining example of public safety cooperation and generosity, and is keeping with the highest traditions of the St. Paul Fire Department. I hereby award you the Fire Chief's Special Commendation in recognition of your superior and lasting contributions to public safety. I commend you for your extraordinary work. So a letter like this will go to each of our partners, and I appreciate again your work on this. And now I'm going to have EMS Chief Matt Simpson and Mr. John Daly demonstrate the Lucas and answer any questions about the technical operation of the device. Matt?
We are the last major service, so I'm appreciative that we're caught up to where we need to be as a department so that we can better assist the citizens and really our own firefighters in the city of St. Paul. I think this is a twofold benefit in that obviously we're going to have a consistent CPR that's superior to manual CPR, and it's going to offer our firefighters safety in not having to stand up and transport a cardiac arrest in the back of a moving ambulance, as was mentioned before. So this is again a twofold win-win for St. Paul. This is the Lucas device. It comes packaged in this little backpack, so it's easy to get out of the rig, in and out of the rigs. If we arrive on a cardiac arrest, we can just grab the bag, bring it in. It sets up in a matter of 20 to 30 seconds. This will be active on a patient. So we're going to try to get ourselves down to that 20-second mark, but John's going to help us get there, right? Yeah. So again, it's got a board that goes under the back, a back plate, if you will, that fits under the back of the patient, and this unit collapses, or not collapses, but basically hooks up and is in situation readiness. We grab it, we power it up. We bring it down to the depth of the chest that we want to make sure that the plunger hits the chest, which once that makes that connection, it will only go to a 2-inch depth to give us that consistent CPR that we're looking for. And once we get it set, we lock it in place, and then we simply push start. It's that simple, and that's the operation. So that's the benefits. It offers the possibility of an active compression and decompression. There's the suction cup, for lack of a better term. When we push down, the plunger pushes the chest down, and if it's got a good seal, it's not mandatory that this works this way, but if it does make a good seal, it will pull up on the chest, allowing that cavity, or the heart rather, to refill with blood much more effective. So that's another benefit. And again, our firefighters do not have to stand up during the transport of a cardiac arrest patient. So that offers us as well some safety features that we've never had before.